Hello, my name is Miguel Carvajal with Almost Park Animal Hospital, and this is the video assignment submission for Clinical Pathology 1, VTHT 2223-31420. And in today's video, we're going to demonstrate the following. First, jugular venipuncture and sample collection from our patient. 2, our blood smear or blood film preparation. 3 is our procedure for staining the blood smear or blood film. And then 4 is the evaluation of the blood smear or the blood film, which will consist of our RBC differential. And finally ending with our in-house packed cell volume and total protein. We are here in the treatment area with our patient Mila here, and we're going to go ahead and get her ready for the jugular venipuncture and sample collection day. I have our EDTA tube with already our anticoagulant in it, and we'll collect in this tube and then make our samples for the PCV and our blood smear with us. Good girl. And now we will head to the lab area to go ahead and begin our slide preparation. Here in the lab area, we're going to begin preparation for our wedge smears. Now I'm going to just invert our sample here just to get it nice and mixed again. I do have a couple of applicator sticks that we'll use to go ahead and get these drops onto the slide. Now what we'll do is there's a technique that needs to be practiced when you go and start these wedge smears. What we'll do is we'll go ahead and place a drop here on the slide. And what I'll do is I will hold my other slide at about a 30-degree angle, and what I'll do is I'll move the slide back and allow the blood to go across the slide, and then I'll push forward in one fluid motion, allowing the sample to feather across. Okay, and we're here in the lab area, and we'll go ahead and begin the procedure for the wedge smear. What I'll do is use a couple of applicator sticks and place it into the sample here to get an amount for our slide here. And what I'll do is I'll transfer that one drop of blood here toward the end of this slide. Now next I will get the other slide, and just holding it at a 30-degree angle, what I'll do is I'll bring the slide back into the sample and allow the blood to go across the slide, and then I'll push forward to feather it out. Now I'll go ahead and place the slide here to dry. Okay, and our blood smears or blood films have dried. Go ahead, we have two here ready, and we'll go ahead and begin the staining process. Now this differs somewhat from cytology to blood film. Usually we'll be dipping into these stains and moving across, but what we're going to do is just leave these in each of these stains, in the diff quick stains, for 30 seconds, and this will get the best staining possible when we go to evaluate. So the first one I'm going to do is go ahead and place this in for 30 seconds in our fixative. And I'll go ahead and just watch the timer here for the first stain. Alright, and now we're going to move on to our second stain, which will also remain in there for 30 seconds. and then we will move to our final stain. Go ahead and let that one remain in there for half a minute as well. Now after we're done with this third stain, what we'll do is we'll rinse the slide both sides with our distilled water here in our laboratory sink, and then we'll let it dry here for a drying period on the bibulous paper. Okay, and we've approached our 30-second mark here for our final stain. I'll just let the remainder of this dark stain just come off the end of the slide here and catch any remaining here on our Kim wipe, and we'll make our way to our laboratory sink. What I'll do is I'll go ahead and begin the rinsing cycle on our slide. I'll make sure to go across so we can get rinsing on both sides. That looks good there. Now just let it sit here for a drying period, and then we'll be ready for evaluation on our next step. Okay, while we're letting our blood smears dry here, I'm going to begin filling the hematocrit tubes with our sample here so we can begin our packed cell volume. I went ahead and just got a sterile TB syringe and drew from our EDTA sample tube. It's a lot easier and cleaner to fill these tubes up this way. What I'll do is I'll just invert the actual sample tube, and the blood will actually start going into the tube itself. Alright, we have our tube filled up. I'll use our crit seal, our Vitrex hematocrit clay. Go ahead and just make a seal. And of here. Just use these holes on the side to hold the rest, and I'll go ahead and repeat one more time and get a second tube ready to go. Same thing with the clay. I'm going to place them here and get ready for centrifugation for the packed cell volume. Okay, and I have our hematocrit tubes here ready to get spun down, and I'm here in front of the centrifuge. I'm going to go ahead and insert my counterbalance. And on the other side, I'll go ahead and place these tubes in here. We'll centrifuge for a period of 2 to 5 minutes. Our blood setting here. And I will start the timer. Okay, we have our feathered smear here stained and already under our microscope stage. So I'm down at 10x, and I'm just going to go ahead and start scanning the field. And I'll start right from where we began the smear at the thick part, just to kind of survey the smear. Things look stained. I can already see various white blood cells here on the slide, and I'm going to go ahead and make my way across to the feathered end. Now, one thing while you're scanning the slide is it's good to start at the very end of the slide, or the feathered edge. When you're creating the slide, usually around that feathered end, you will encounter any parasites that will kind of get pushed when you're creating the slide, and that's just a good area to visualize that. And if you'll back up just behind there, you will encounter the monolayer, where you would do a lot of your counting. And I found a very nice area in which to do that. Differential count. I'm going to go ahead and move up to the next objective just to scan it one more time. One thing we'll look for when we're surveying these RBCs is just the RBC morphology. Look for any subcytosis, RBC crenation, polychromatia, things like that. Rear low, you can see the stacking of the RBCs as well. I already visualized neutrophils here on the slide as well. And that is just what we look for here when we're evaluating just the RBC portion. Of course, we will go to the oral immersion or the high-powered field to do our white blood cell count there, but we will not be doing that today. Now in just a few moments I'm going ahead and get our microhematocrit tubes, and we'll go ahead and get our PCV percentage and then our total protein. Okay, now we're ready to go ahead and evaluate our PCV tubes that we spun down. I'm going ahead and get the first one. So what we're going to do is we're going to use our microhematocrit tube reader, and what we'll do is we'll just line up our clay plug here at the very end to the very top where our red line is in our tube. Go ahead and get our percentage here, and we're about 55% for our packed cell volume. Now what this means is this is just the percentage of whole blood that is composed of red blood cells. Okay, now that we've got our packed cell volume percentage, the next thing we're going to do is get our total protein. So what I'll do is I'll go ahead and crack the plasma end of our tube here, and we'll go ahead and get a specific protein on using our refractometer. Now I've already cleansed and calibrated our refractometer to manufacturer specifications. So I'm just going to go ahead and crack our tube. And I'll go ahead and place our sample on the refractometer. And our total protein is right at 9. Okay, we've concluded our evaluation of the blood smear as well as our packed cell volume and total proteins. I'm just going to go ahead and go over the findings from today's hematology video. So our RBC morphology, that was within normal limits. I did not see any abnormalities. Our packed cell volume for our patient was 55%. Our total protein or total solids was 9 grams per deciliter. Now we have our estimated hemoglobin concentration. Now that was taken from getting the PCV, the 55%, and dividing it by 3. So we're at 18.3 grams per deciliter. And then our estimated RBC count. Now this will be represented in scientific notation as millions here. So it's the PCV divided by 6, which got us this number here, the 9.1 times 10 to the 6, representing the 6 zeros in the millions, and of course our value here, microliter. And that concludes our evaluation for our hematology video.